Hello, I'm Dr. Gerald Lewis. This page on my website is on atrial fibrillation, which is becoming increasingly important as we have an aging population. In fact, the number of people who have atrial fibrillation is now growing almost exponentially, and this is because as people both get older, but also as more and more people have cardiac investigations and treatments, they're living longer, and some of those treatments can also precipitate atrial fibrillation. It's important to understand what atrial fibrillation is, and hopefully on this page I've discussed this and made it understandable to you. It's also important to look at what doctors can do, because doctors these days can do a great deal more than they could in the previous days, including some fairly exciting investigations such as ablation and similar treatments, where they can actually have an operation relatively simply through a vein in the leg or the arm, and can actually stop the atrial fibrillation occurring. It's important to understand what atrial fibrillation is, the symptoms of atrial fibrillation, and also what you should do about it. It's quite exciting these days. Previously, everybody on atrial fibrillation needed to go on warfarin, which needed regular blood tests, and people didn't like warfarin because of the connotations of it being a rat poison, which is if you gave a rat the dose of any drug, the amount that we give warfarin to in rat poison, it would kill them. So the fact that it's used as a rat poison only is because it's convenient, not because it's a dangerous drug, because warfarin actually is one of the safest drugs that we have. Nevertheless, some of the newer anticoagulants don't require blood tests, and therefore have made a great deal of difference in the quality of life for people with atrial fibrillation. And it's pretty crucial for people with atrial fibrillation, in the vast majority of cases, to be on anticoagulants. I also discuss many of the medical treatments that are available for treating atrial fibrillation, particularly slowing the heart rate down. And it's important, for example, if you have atrial fibrillation and you're not on drugs that slow the heart rate down, such as calcium blockers or beta blockers, just make sure that your heart rate doesn't go too fast with exercise, because this can often be a cause of breathlessness. There are a number of complementary therapies that can also help with atrial fibrillation, both in preventing AFib in people who have intermittent atrial fibrillation, but also in helping patients with atrial fibrillation to cope better with it. So I encourage you, or if you've got a relative or a friend who has atrial fibrillation, have a good look at this page and see if there's make sure you're doing all the things that are necessary for it. As always, I am available for consultations, so if you've got any questions on atrial fibrillation, I'm very happy to give an online second opinion or advice if you wish. So once again, go to the consultation page on the website. I hope this is helpful.